Good afternoon and welcome to the 17th in our series of Tea Tuesday events and the 12th of 2021. My name is Hilary Woodhead, I'm NAPA's Executive Director, and I'm delighted to host these live events which enable me to drink tea, and I've got a great big cup of tea today, and chat with industry experts who just happen to be lovely people. So this is a free event. If you'd like to make a small donation, perhaps the price of a cup of tea or coffee, that would be amazing. We have details of how to do that in the chat, and we have a donate page and you can text in. It's all very, very easy. So today I am delighted to be chatting and drinking tea with Vic Rayner, who is Chief Executive Officer of the National Care Forum. She's a regular national and international speaker and has extensive knowledge and expertise across a wide range of care, support and housing and social policy agendas. And today we're going to be discussing an area of mutual interest, which is enabling wellbeing in care homes, particularly over the winter. And we're going to spend the next half hour or so chatting. We hope that you will join in. Please post your questions in the chat and your comments, and we'll get to those as we go. And please say hi, just say hi, who you are and where you are. That would be lovely to hear. And for those of you who might want to just let your colleagues know if they're caught up doing something, if they're busy, that this is being recorded and we'll get that out to them as soon as we possibly can after this afternoon. So, hi Vic.
Hi.
How are you?
I'm good, thank you. How are you?
Very good. Welcome to Tea Tuesday.
Thanks.
Lovely to have you here. So we've got some questions. I've got some questions, and we've got a couple of questions from our helpline as well that we're going to hopefully have a chat about. And please post your questions too, and we'll get to those. But I just want to kind of start off really, Vic, with asking you a little bit about yourself and about the National Care Forum and why wellbeing, as broad a term as that is a topic of interest to you.
Okay, so thank you very much. Really delighted to be here, and obviously always delighted to have a cup of tea with you, Hilary.
Thank you, Vic.
We tried to start off doing that before all this hit, as we don't live too far away from each other, and we were thwarted. So it's great to have lots of digital opportunities to do that. Yes. So I'm Vic. I'm the Chief Exec of the National Care Forum. We're a not-for-profit, we're a membership organisation for the not-for-profit care providers. So that means our members work in care homes, which we'll talk more about today, but also provide housing with care, home care, supported living, day centre support, a whole range of different scenarios. And often those organisations provide all of those things in one locality. So they're often the kind of local charities or housing associations that have a presence in an area and cover across the range. And I came to work in this sector, work in care just over 5 years ago, having worked prior to that for many years in the supported housing sector, and always in the voluntary and community sector in a range of different areas: advice, advocacy, community services, domestic abuse services, and so forth. So I am that proverbial stick of rock that if you split me in half, I would say not-for-profit throughout it. And I'm a trustee of a range of different organisations, a couple in the UK and on the board of directors of the Global Ageing Network as well.
Right. Wow, you fit a lot in. Yeah.
Like it.
And this term well-being, which we talk about a lot, what does it mean to you? Why is it something? Because when we met, as part of my induction, you said, you know, let's focus on well-being, and that really has stayed with me over the last couple of years. What does it mean to you?
So I think for me, on a kind of personal level, it is about, if I think about my well-being, and it's really hard to do, I have to say, it's easy to avoid doing things that are around your own well-being. And I think that's why the role that you and your colleagues play is so important, because what you're doing is finding a way to enable people that you're working with to do things that are important to them and that make them feel good and make them feel good about themselves, perhaps in a kind of contribution and a way that means that they are showcasing their skills or experience, or makes them feel good in a physical way, because they're doing something that is enjoyable, that, you know, gives them some endorphins, reminds them of smells and tastes that are from their childhood, connects them with happy memories. I think there's loads of things that are you know, sensory, physical, mental, that all contribute to that sense of well-being. And it kind of feels like, and I think some of that conversation we were having, you know, is because in a way I think there's a growing acceptance that looking after your well-being is almost a fundamental of life. Yeah. And I think that puts the work that all of you do right at the centre of what care should be about. And I think that's exactly where you should be. And I think that using that term is probably going to get ever more important. And not just for the people we provide care and support for, but for the people who work in the sector.
Yeah. And I think that's the focus, isn't it? That if we can prioritise well-being, we have to prioritise well-being for everybody. We can't pick and choose who that might be for, and we have an understanding of why it's important. Then it's important for absolutely every single one of us. We can't say, well, I'll look after my well-being a week next Thursday when I've got 10 minutes. It has to be absolutely.
That's not how it works.
It has to be absolutely fundamental to kind of our very being, doesn't it? And the way in which we approach our work, whatever our work is, but when we're working with people who may have support care or support needs and have an expectation, or perhaps their family has an expectation about what well-being should look like, we have to be quite clear, I think, about what our understanding of it is, and how we hope to achieve that for ourselves and for the people as well. And I think there is a growing, I agree with you, there is a growing kind of focus on the importance of emotional and psychological well-being, as well as kind of physical kind of care practice.
And I think
that's all intertwined. Yeah, I
don't think we've understood that enough, particularly for work with older people, but across all ages. And you know, we have to be careful not to prioritise one over the other as well, in that sense. The physical kind of well-being side of things is really essential, and again, you know, we won't come on to talk about the white paper in a bit, but in a way that there is some interesting things in there about core strength development and kind of physicality that I think will again show a growing understanding that we need to do those things, and we need to prioritize those things in order to give people an opportunity to retain choice and control, and to retain individual you know, ownership and of themselves.
Absolutely brilliant. So as we, you know, we can't help but reflect on the last 18 months. I know that we've you know, we're all still immersed in it and what might happen over the next few months, but I wonder what your view is on how the perception of care has altered or changed over this period of time. Do you think there is a different understanding of of social care and how it's provided?
I think there are, yes, I think is the short answer. And I'm not very good at short answers, so I could just stick with yes. But I mean, you probably want me to. I think it's absolutely, it was absolutely apparent at the beginning of the pandemic that there was very limited understanding in a government and policy and public perception of what social care does, and what all the amazing people who work in social care do, and all the amazing people who receive care and support are all about. So I think it would be impossible for people to say at the end of all this that they didn't know social care was an important thing to understand and think about. And indeed, very sadly, that a lot of the people who receive care and support were and continue to be particularly vulnerable to this kind of public health emergency. What's so frustrating for anybody who works in the sector is that we had to have something like this to get people to that place. But has it changed people's perception of social care? So yes, they know it's there and it's important. Do they fully understand what good, great social care can do. I think we're still a long way from that. I think we have got a really strong narrative about what health does, which is that it saves lives. I think the other side of that coin, which is what social care does, is it changes lives. We haven't got that there. And it's, as long as it's still possible for politicians of all different party backgrounds to stand up, and I've heard them all of them say it in different ways, that what social care does is feed people, dress people, and get people out of bed or into bed. As long as people continue to just feel that they've encapsulated the breadth of social care in those sort of 3 or 4 task-based functions, then we've got a long way to go still. And I think that's back to the well-being point in a way, is that actually if what we can do is really clearly show people that the stuff that your colleagues do has some very significant transfer, and we've seen it. I think there's some amazing examples, particularly around music and dementia, where it's absolutely possible for people to see that activities and music and art as well unlock people, transform people, give people things back that they and their families might have thought were gone. Then that's the sort of story that we need to be telling much more of. And I think that's the point where people will really begin to value what social care can do for everyone.
Absolutely.
It's matter to everyone. We've got to make it matter to everyone.
Yeah. Brilliant. Thank you, Vic. So, we're approaching the end of the year. I've got my tree up just about, and thinking about what potential announcements there might be over the coming days and weeks. Can you just kind of fill us in a little bit on what we know already and what potentially might be coming in terms of guidelines for care homes over winter?
Yeah, well, I will caveat this, Hilary, because I know people sometimes watch this afterwards, and I'm talking today, Tuesday the 14th at 2:43. Who knows what it will be able to say by 4 o'clock? But what we're expecting to happen is that, as was announced late on Friday night, there will be a series of changes around the guidance around care homes particularly, but around wider care settings. So that will do a number of things. There'll be an change in the testing regime for staff. There will most likely be restrictions around visiting. There will probably be some further changes that appear along the way. What we know has previously happened and still, I suspect, remains possible within the guidelines is that local areas, local public health teams might make different decisions about what can and can't happen. What is really not clear at all at the moment is, for example, and we've asked the question and haven't seen the answer yet, that when we talk about visiting, there's a lot of talk about visitors and nominated visitors. It doesn't tell me anything about people who are not visitors and whether they can come into a home. So, for example, if people have got school children geared up to come in, can come in. I mean, it's not clear at all whether those things are not intended to continue to happen. So I really feel for colleagues who are worried about what will it mean tomorrow, and we're trying to get as much certainty around that as possible. It's difficult to know, and I think the other thing that clearly is happening right now is that there's a massive increase in terms of the booster programme, and we know that the levels of take up for both residents and staff is much lower than the levels for the 2 first doses. So, as everybody has been saying, if people are able to take up those boosters, those are some of the things that will make a difference.
Yeah. I think one of the things that we know about the workforce we support, particularly the activity providers, is that they like to plan. They like to know what we like to have particularly this time of year, lots to look forward to. I think just starting again to kind of re-engage physically with the community and having lots of plans for parties, on a small scale, but that was starting to happen again. And so there is obviously going to be some disappointment around that, particularly if there's this uncertainty, and particularly if there is an inconsistency at local level around, not an inconsistency, but that there are different messages at local level from public health about what people can and can't do. Is there any kind of words of reassurance about all of that for activity providers as we kind of navigate December and January?
I think the main thing to do is to really, keep as clear, keep as strong a focus as you can on the guidance that's there. People have been incredibly creative around using technology. For example, I'm afraid we will probably be back into doing some more of these things virtually than we would have liked to do. Yes. It's just it's a very uncertain time for everybody, unfortunately, and I completely recognize I think it's not even kind of a hope, it's a need, really. I think for care homes and for people living within care homes, this is a lot of the work that we've done around, particularly around access to visiting, is because there's a very, people love people, people need people, and anything that limits that is I find very difficult to kind of work through what's the best. I mean, people can cope with not doing something for a week or but I heard a brilliant description, and I can't remember who quoted it, but it was talking about Sheffield, and it was talking about care providers saying, it's like we've been living for 20 months in a big snowdrift. The sort of things that you might put in play for 1 or 2 or 3 days of a big dump of snow, you've had to try and manage with for 18-20 months. So I mean, it is the only thing I can say with certainty is that you will respond brilliantly, and people will continue to have a great time, and that's really important, and I think that's a really important public message. But it doesn't take away from the fact that nobody is going to be doing things in the way that they wanted to, and the people, unfortunately, suffer the most are the people who are living within those care homes.
Yeah, I completely agree, and I think what we've seen is such creativity, haven't we? We've seen people managing brilliantly, and some of the just in terms of our membership, and I know we have lots of members in common, but just across the sector, full stop, the creativity with the use of tech, but also just how staff have really kind of thought different, practiced in a different kind of way, and been more willing to have a go, whether that's at the tech or perhaps to spend one-to-one time with people, perhaps when it wasn't traditionally their job. Great examples of people really thinking creatively, and so more of that potentially over the next few weeks. And I think one of the things I remember last year, we had a phone call. I remember ringing you about Christmas baubles, about Baublegate, and this has popped up again, Vic, on our helpline over the last few days. So this is about on a practical level, concerns about Christmas decorations, Christmas cards, Christmas presents, and the risks around infection control. I think risk and infection control, it kind of, we know it's important, of course it is, more important now than ever in many ways, but how can we try and manage that sensibly without spoiling the holidays?
Yeah, I mean, I'm hoping it's less prevalent than it was last year. I've seen one example of it, which clearly was a bit of guidance written for a hospital that had been kind of translated to apply to a care homes. I mean, I think I mean, if people are receiving that kind of stuff, send it to me. I'd be delighted to take up the challenge in a way, but I think much of our understanding about COVID is that the things that we need to be focusing on are around ventilation, all of the things. What I clearly couldn't say is that if that has been your local public health advice, you should not observe it, but what you can be doing, I would suggest, is that you can be challenging it and asking why, and then, you know, thinking about what the sort of possible solutions are. But I mean, if to this point you haven't been sealing people's letters off in a hermetically sealed room for 3 days before you hand them over to people over the last 6 to 8 months, I suspect the fact it's a Christmas card shouldn't make any difference to that.
No. Brilliant, thank you. Sensible answer. So as we've said, you know, there's been some great examples of creativity and creative practice. Is there anything in particular that kind of really stands out for you that demonstrates how a care home or care service has really, you know, prioritised well-being in amongst all that they've had to deal with?
Oh, there's so many, Hilary. So one thing I would mention, so we produced earlier in this year a lovely book called Caring in COVID, which highlighted a lot of examples from activity providers about the sort of things that people did and continue to do. A great one that I thought was really good from Wellbeing of Workforce and people who were living within care homes was Sanctuary, who did a virtual cruise across all of their homes, and you know, and shared images between homes and shared themes and ideas. And I just think that was just, to me, a really great fun example. In a way, I think what really appealed to me was that it suggested that kind of care home residents were in the same boat, excuse the pun, as everybody else, in that they couldn't travel, just, you know. And so all the things that other people were doing, like saying, oh, this time last year I was on the beach in Thailand or whatever, it was exactly the same message from the people within the camps. They were remembering all the wonderful trips they had taken, and they were reminiscing, and they were and it was that there was a kind of equalizing element to it that was really nice. And I think for staff, I mean, staff just extraordinary, kind of, you know, willing to put on the costume. I mean, you know, we were talking earlier, weren't we? And I was saying I would put on my hat, which I can do now, but, you know, I feel ridiculous wearing it. That's not my, I can't do that. I really do literally take my hat off to the people who are happy to do this day in, day out, and just make people laugh and enjoy themselves. And I think so there's some great examples of that. And I'll just mention one other thing, is that we've got a advent calendar going at the moment, which is talking about every day 2 or 3 just really nice kind of videos of the sort of things that people have been doing, and to continue to celebrate birthdays and to connect people. And so I think there's just a load out there. And we did a really nice project together, didn't we, called Moment in Time, which was a time capsule project to sort of, I think we were trying to say this is the end of COVID, but there you go. That's we'd be no good in the crystal ball gazing department. No, we would, to capture what homes had been through, and getting people together as a community. And Natalie from your team did an incredible job of bringing together activity coordinators to say, you know, this is how you can do, this is how you can bring together people's memories, this is how you can mourn the people who've gone. And these are all really important bits of well-being that, you know, there's the fun kind of side of it, but there's also the bit that lets people cry and lets people remember and lets people connect. I think it's so important. And I think this time as well, this time of year can be a very reflective time of year for many people, can't it? And if they're unable to connect in the way that perhaps they were planning to this year, again, that can you know, provide, there can be opportunities there, I think, for all of us to reflect and to talk about, you know, in our experience of perhaps not being together, but also reflecting on times when we were together as well. And that's, you know, and that's, you know, that's a reminiscence activity-based approach, isn't it, to well-being. I mean, one of the things that I think about quite a bit is opportunities for staff really to think, to make sense of what's happened over the last couple of years, and whether or not there is you know, I mean, talk about the white paper, but what there is in the offing really, I suppose, to support staff longer term. And because I don't know if we completely
we're there yet in terms of understanding the impact it's had on staff. Any thoughts on staff wellbeing moving forward?
Yeah, so I don't think we have understood at all the impact on staff, really, just because I think it's very big. You know, it's quite a big concept to work through. So I'm on the board of the Care Workers charity, and we have been, you know, doing lots of work to kind of support, provide financial support for people during COVID. Care workers in all sorts of different situations, but also over this last year developed a mental health support offer. So that, you know, that is a kind of recognition that you need to, you know, people who want that support, they can have kind of up to 10 hours worth of one-to-one counselling support, and that, you know, that's quite a sort of concrete offer in a way. So that's just having that around and being able to fundraise for that is quite an important step. There is a lot of additional support that's out there in terms of helplines, so the Samaritans and Mind, and, you know, I can't remember, there's another 2 organisations involved in it have come together and provided a helpline for health and care workforce, and there are recovery hubs in lots of different NHS localities that care staff can use. So there are resources out there. The big challenge is, you know, if you identify, and I think this is partly why we haven't addressed it properly, is of course if you identify that somebody has PTSD, and I think these are the sort of things that people are really talking about, then you've got to properly be able to support them to recover.
Yeah, absolutely.
So that doesn't mean you say, yes, you can go and have the 1-hour counselling session, and, you know, that, well, you can, you know, and that's, we'll pay for that hour. You know, it might mean that you need to be able to pay for 2 to 3 months for them to have some time away to recover. And I think we just haven't got we haven't grasped that. So you mentioned the white paper, and there is in the white paper, and I think it is really important, and I've certainly advocated strongly for a focus on occupational health. So recognising that we have lots of little organisations across social care, many of whom won't have anything that looks vaguely like an occupational health service. So having that, and then also having sort of recognition that there will need to be additional wellbeing services for staff. And this all comes out of this £500 million that has been recognised for development and wellbeing. So that, you know, those are good, important steps. And so my hope is at the end of that 3-year period, in that sense, that is available for the bit of the white paper that they've got kind of costed out, we'll have something that looks more like an infrastructure for wellbeing for staff, and that will be a really important step forward.
Absolutely. And you mentioned helplines, and of course, you know, the NAPA Helpline isn't a crisis line, you know, we're a support service, but we are part of the Helplines partnership. So if somebody calls in, we can refer them appropriately to a helpline that would, you know, not that helplines are the answer, but sometimes they can know at local level what services are available for people, and just, you know, provide that listening ear. So so just, you know, just a reminder really that it's a place to start, the NAPA Helpline. If you have the number in your pocket, please give us a call, and we will make sure that we signpost you to the relevant agencies. We have got a few questions come in. If you've got a few more minutes with us, Vic, if that's all right. So this one is from Marco. Marco's an activity coordinator in a care home that supports people living with learning disabilities and dementia. He says, I'm so worried that we're about to lock down again. The people I supported last time were so thrown out by the change in their routine. It's hard to think we're going to have to face that again. How can we cope with this? I just thinking.
Well, I mean, I think
Marco.
Yeah, it's a great. Well, it's, you know, it's a great question in the sense, and I think hopefully there will be some things that are different, and, you know, again, this is something that, whether it's your colleagues as activity providers or managers or whatever, will need to advocate hard for. But we're now in a position, and I don't think, well, we'll see what the guidance says, but my understanding is this won't change, is that everybody should have access to something called an essential caregiver. Now, I know with working age adults, people living in supported living settings, you know, that routine is not so much about people visiting in, but about people being able to go out. But my understanding again is that at the moment, the guidance that we're expecting to appear will continue, as long as people are vaccinated, to continue to enable people to go out and about. And at that point, the same restrictions as the rest of society will apply to those people. So, you know, if we do have vaccine passports, if we do have restrictions in gatherings, that will apply to everybody. But I think what we've really, I hope we've managed to sustain is that the people who are living within care homes or supported living settings are not further discriminated against through these restrictions. I think it's less clear, and certainly the press release would suggest this is the case for people who are not vaccinated. I think there is going to be, and we will be wanting to find out more about this, but there may be further restrictions and isolation around that, and I think that is incredibly difficult. And I think whatever we can do together to find another way to manage that would be very helpful.
Absolutely. Yeah. Thank you, Vic. And just a question here about how do we influence policymakers? Is that, how can activity providers influence policymakers, get their experience, their voices heard? Any thoughts on kind of the?
Yeah, I mean, there's lots of ways you can influence policymakers. I mean, policymakers, if you look at it at the kind of national level, as your MPs, whether you're lucky enough to have a ministerial role in your locality or backbenchers, or then those are people that you can absolutely be talking about the work that you do. But you've also got a very important voice at a local level. So there are lots of, it's difficult, I know, when you can't open the doors in that same kind of way as you might have done a couple of years ago to sort of get people to come in and cut the ribbon or sing a song or whatever it might be. But there are ways in which you can be inviting people still into your home through Zoom or whatever it might be, or if you're running carol concerts, or utilize some of the great stuff that NAPA's been doing about making engaging events online and get those local people in there. But ultimately, all of these things, it's about a clarity of message.
Yeah.
So what do you want to influence them to do?
Yeah.
And I think that's back to that well-being discussion. At the end of this, you need to be, you want to be able to say, COVID has shown us that unless we have a properly funded and an equitable activity provision in every home, then there are groups of people who are much more disproportionately impacted by closures or lockdowns or anything than other people and it shouldn't be the preserve of wealthy organizations that can afford to have activity provision. You need it's something fundamental to each and every person who's living within those settings. So I think that, I hope that one of the central messages of NAPA will be, the idea that people have £1 a week per person or whatever it has got to be retired immediately. I was talking to a colleague in Israel when we were having they very generously, through the Scheinberg Foundation, supported some members to have some of the OBI tables, these interactive tables.
Yeah. And
in the conversation with them, they said as soon as the lockdown came, the Israeli government sort of essentially demanded that technology providers thought about how they could alter and amend things to help support communication and engagement with people in residential homes. So that's the sort of thing that we need, if you sort of set yourself a kind of ambition of the thing that you can all be on message on. It's that, this is, if it's a levelling up agenda, then, let's talk about levelling up activity provision or levelling up well-being, and recognising that it shouldn't be the case that it's down to the vagaries of budget setting in homes that people get good well-being. Everybody deserves it.
Music to my ears, absolutely, absolutely. Just one final question before we kind of wrap things up, and this is about your any top tips for ensuring a happy and healthy kind of winter. Anything that, you know, in terms of what you've learned maybe over the last 2 years or across your career, but anything potentially that you'd like to leave our audience with this afternoon?
Well, I'm not very good at it, so it's not a great, I'm not a great advocate, I'm not a great do as I do or something, but I just think that bit about your own well-being is vital, because at the end of it, if you're the one who looks after everybody, that ultimately means nobody's there to look, you know, you run the risk that nobody's there to look after you. And it's really hard. I think it's particularly, you know, for the settings that people are in, that it never ends. There's always something more you can do, and that's exactly how I feel in my job. But you know, it's always so I think just having some sort of way, some shut-off valve, something that's completely absorbing, that means you stop thinking about work or stop doing work, is probably really important. And I'm imagining, I know what a great community you all are, and so I guess there's an awful lot of peer support within there that's going to be really important.
Yeah, but having something to do that's completely unrelated to work but is enjoyable.
Well, that's and that's hard for you as activity provider, because everything enjoyable you do in work. So you're going to have to kind of you know, I don't know, sort of read the dictionary backwards or something like that. Yeah, all absorbing, but won't, so I don't know, you know, I just think that there's something, and lots of people have got family and that's great, but not everybody's in that situation. So it's, what is it that will be, what is it that makes me feel good and do it.
Do it. Brilliant. Thanks for that, Vic. So well, thank you very much for your time and your expertise this afternoon. It's gone by in a flash. As we said, please, you know, if anybody wants to comment or have any questions afterwards, we can put them to Vic by email, or you can ring the NAPA Helpline. That's, you know, we're there every day of the week. Or the Facebook page as well. You can post your comments in relation to today's Tea Tuesday on the Facebook page too. Just a couple of NAPA announcements. Tomorrow and Friday are the Connect by Candlelight concerts. So if you haven't got your ticket already, it's still time. Please, please, please come and join us tomorrow afternoon or Friday afternoon. We have at the moment 3,500 confirmed audience members. So we are absolutely delighted with that. So we're looking forward to a truly magical experience. So do come and join us if you can. And our next Tea Tuesday will be on the 25th of January, and that will be as part of the first ever UK National Activity Providers and Professionals Week, which again is in partnership with NCF and Care England and Scottish Care and our friends in America as well, who've been running a Activity Providers Week for more than 20 years. So some really lovely things to look forward to in that week, which is the 24th to the 28th. And the 25th is Tea Tuesday, so you can pop onto the Eventbrite page and book on there. And the focus of that Tea Tuesday will be our year off for 2022, which is the year of creativity. And the topic is, what is creativity anyway? So we're going to have a little panel discussion about what creativity means to people, and not just creative activities, but creative approaches as well. So look, we're all looking forward to that. But for now, time's up. Thank you very, very much, Vic. Thank you for everybody that's here, and we'll see you soon. Take care. Bye for now. Bye-bye.